I wanted to start my private practice, and St. Mary's Hospital made me a deal. They said to me, you know, you'll have immediately over 600 patients because our staff will come to you. So I said, that sounds great. After my 4th year in practice, I brought in a good friend. Walter Bundy was my first partner.
My name is Walter Bundy, and I've been here for a while, as you can tell by my gray hair. And we began Virginia Eye Institute back in the early 1980s.
Tony Sakowski started his practice first, and I started second. Todd Dabney was right there with me, and we were all practicing in different venues. And Walter Bundy joined Tony, and the two of them asked me to join them. And so we merged our practices, and then Todd joined us as well, and that was the genesis of Virginia Eye Institute.
I always wanted to practice with people who I thought were as good as I was. I thought I had some pretty high standards, and I thought I was a pretty good eye surgeon, and I wanted to have other people of that same character. And certainly that's exactly what has happened.
Our reason for the existence of Virginia Eye Institute was to bring a model where we had the best generalist and subspecialist all under one roof.
We started off with 4 partners and grew fairly slowly initially, and we're fortunate enough to be able to attract some very talented subspecialists. And over the last 25 plus years, we have pretty much accumulated and incorporated as partners all the subspecialists in ophthalmology that we would like to have.
The people that we now have coming in or have CVs that a lot of us would just dream about. I mean, they really are very, very qualified.
We wanted to have a practice that was big enough to serve all areas of the city itself, and also reach down into Petersburg and Colonial Heights. And then the 4 of us built this, and Winston Trice joined us shortly thereafter.
When we started out, we just had 5 of us in the group in this building, and we had a 2-room ambulatory surgery center. Now we've got, I think it's 12 different offices, and our ambulatory surgery center.
I think what sets us apart is the excellence of the care.
Patient care obviously is the big thing that you go into medicine for, and ophthalmology gives you a great opportunity to see big turnarounds in patient outcomes. You can take a patient who is having difficulty doing many things, driving, reading, functioning in a job, and give them good vision almost instantaneously. So it's been very rewarding.
One thing that's been our philosophy all along is that we just want to hire the strongest doctors, and we have the ability to find some really good people and attract them to come and work here. We've got about 30 doctors on staff, so we've got specialists in retina and glaucoma and plastics, and that means whenever I run into a problem, I can just walk down the hall and ask one of my friends to help me out with that. When we refer patients, they're all using the same electronic medical record, and communications are very good.
To be able to get those second and sometimes even third opinions, and to have the ability to treat the wide range of ophthalmic diseases that we're able to do because of our size, makes it a special place to practice.
We just have a variety of subspecialists that excel, who are published often, who are involved in current research. That's what distinguishes Virginia Eye.
I think as you go up and down the East Coast, Virginia Eye matches up with just about almost anyone. I mean, you're always going to have the Hopkins and the Duke. You're going to have all the 100 professors and all that. But as far as a private practice goes, we're certainly one of the largest in the United States, and I think the best.